going to be. I think there's speculation, Apoku, that Boris Johnson is going to obviously scrap the isolation period. I think that's what we're hearing, isn't it? Yeah. So I think, I mean, my take, I don't know what your take on that is I'm not really sure, to be honest, if I'm honest with you. Yeah. What is your take on that?
I don't know. I'm torn, to be honest. I'm torn. On one hand, I think it's about time that we know COVID enough now. I'm talking for both sides here. Yeah. I think on one side we know COVID enough to be able to live with it, and of course we'll have to keep a certain discipline.
Yeah.
We've got to keep certain disciplines going on to be able to live with COVID. But on the other hand, reading what other people are saying about the fact that it's too early, and also that people are going to become complacent if all these restrictions are lifted this early. So it's two ways. I mean, it's this and it's that. I cannot give you a specific in answer to that question. I don't know where I stand with this. I want to be able to live with it.
Yeah.
But at the same time, I don't want us to be complacent. I don't want us to just say, "Oh yeah, COVID is gone, so let's just crack on with life." So that's my take on that.
I love that. Your take is really well balanced argument for and against, and I think it's important to understand why Boris Johnson is going to make any decision in terms of living with COVID, and so I think basically what decision they will make, I think it will be dependent on whatever the evidence is and the research is, whether they need to scrap the isolation period if anyone tests positive for COVID, balancing that against the risk of COVID-19 as we've known it since the pandemic, since 2019 December. So I think it's a very difficult decision to make. I don't think
it is. Yeah, it's a very difficult decision, and I will dare to say that they would have gone through everything scientific, social, and everything. They would have had all their facts sort of streamlined or properly. They would have facts to back the decisions they're going to take. I'm just daring to say that, and I believe that is. I don't think the Prime Minister and his cabinet will just get up and say, "Okay, we're lifting all the restrictions," without looking properly at consequences and looking properly at what's going to happen.
Exactly.
I think if that is done, it is left to us, you and I, to look after ourselves and to look after each other.
Exactly.
That's what I think.
I think so. I think whatever decision is going to be made, as I even pointed out and you've pointed out, it'll be a scientific decision, and we will have to adhere to whatever the guidance is going to be. But at the same time, as you've said, it'll be up to each individual to protect themselves, keep themselves safe, their communities, their loved ones, and wherever they work, to keep themselves at work, safe at work, and in the rest of the world globally. So I think in terms of travel, in terms of getting vaccinated, people will need to still think about, do I travel or don't I travel? Because other countries will have restrictions. So even though our guidance might change after today's discussion from Downing Street, from Boris Johnson, we will obviously have to then make a decision. Each person will have to make that decision, what they would want to do. I think in terms of the decision that they're going to make, apart from scientific evidence, it's obviously going to be, I think, based on Omicron variant being not as lethal as the first two we've had. So in terms of the SARS-CoV-2 variant, where we've had thousands and millions of deaths, and the Delta variant. So the Omicron variant, I think, has been contagious. It's spread quite fast, and quite large number of people got infected. But I think in terms of the lethality and mortality, it was very, very less. And even if someone did get Omicron variant, it was not as severe. So, and even during this time of the Omicron variant, when it started around November 23rd, 24th November, we know that people were still adhering to conditions. So people were still isolating if they tested positive, they were wearing masks, they were hand sanitizing, maintaining social distancing. And even over the festive season, I mean, a lot of us thought that after Christmas and the holidays that the numbers would go up, but in fact it didn't really. It did go up, but then it came down quite quickly as well, and we had less number of deaths. We're still having significant amount of deaths, but not as much as what we've had before. And I think in addition to this evidence of Omicron being a very milder form of the COVID-19, or I say that in inverted commas because obviously I think any form of COVID-19 is something that we do need to take seriously, especially not to pass it on to others. And I think the second thing is the rollout of the vaccines. So because we've had a successful rollout of the vaccines, the first, the second, and the boosters, and we've seen the scientific evidence that having had the vaccines, even if you did contract COVID-19, people then didn't not get a very severe form of the infection. So they still had a bit of protection. And so I think that's the second thing. Then obviously the third thing is the basis that they're making it on is living with COVID. So we need to understand that COVID is going to be there. I think the scientists have predicted, I was reading some research, that it will continue even up until June. So they've predicted some figures, that the figures will go down and the hospitalization will go down, morbidity and mortality will go down, but we will still have COVID. So I think the third thing is for the government to take into context that we are still going to live with COVID-19, and then how do we move forward and also restore freedom, which a lot of us, having had to quarantine or isolate or stay in your social bubbles. I mean, it's been going on since December 2019 from Wuhan, China, when this first started, but then in the UK from March 2020, when we had to start isolating and staying at home and working from home. So it's about restoring things back to normal, I would say.
Yeah, you remember probably more than a year ago, you and I on this same COVID update, on Hospital Radio Bedford, we predicted that it's going to come a time where we just have to live with it.
Yeah.
Remember?
Yes.
We said that. I believe maybe in a year or so, we will just live with it. It will just become like the common flu.
Yes.
We just live with it, and that's what's coming. That's what's going to happen. We're going to have to live with it now.
Exactly, and I think you also spoke about the passports, immunization passports, and how it was in Ghana when you all had to travel. So yes, it's a reality now. All what we were saying and we were predicting over 100 shows which we've done on COVID-19 update. We were obviously hoping for zero numbers, zero deaths. Unfortunately, the fact is that we will have to live with it, and I think making this decision, whether it's for or against, we'll see what the outcome is today. I'm thinking it's highly likely they're going to remove the self-isolation period.
I believe so too. I think
that's
it's been in the news for far too long for it not to happen. You know what? There's some sort of when things start coming up, people are saying, or they say there's the possibility that the prime minister will do this. Then most likely, 9 times out of 10, it will happen. And I believe that's what's going to happen. So it's actually, for me, it's left to us to be able to look after ourselves and look after each other. Be cautious and do the right thing.
I think that's great advice. And just looking at it from a psychological point of view, Opoku, being a psychiatrist, I think it's we've gone through so much. Each person that has lived through this historical moments of living with COVID, we will all have stories to tell, and our kids will have stories to tell, our friends, our families. The whole world will have stories to tell and share with others about how it was to live with this COVID and to live in this pandemic. And I think because we've gone through the highs and lows of the pandemic, there's been so much of uncertainty, so much of fear, chronophobia, people going through psychological problems, of isolation, quarantine, fear of the unknown, having lost loved ones, as I've lost my mom as well, going through grief, people that had relatives and loved ones die from COVID directly. I didn't have that, but I know of people that have had it, but I was going through grief as well.
Yeah, I had it. I had a few relatives die of COVID.
Exactly, and we've gone through so much of emotional, sort of crises, throughout this period from December 2019. So I think it's been like a roller coaster of emotions, and I think we feel now at this moment in time, and I think this is where the government is coming from, and I'm not sure what you feel, but it feels like everything is more contained. We are at a point where things are a lot calmer. We've had time to reflect, we've had time to learn, we've had time to educate ourselves, to protect ourselves, to prevent ourselves from getting it. We're at a stage where things are a lot calmer and more in control. And I think seizing this moment, like Carpe Diem style, seize the moment. I think this is the moment the government wants to seize, to acknowledge what we've been through, how we've overcome it, and how we're going to continue to prevent it, and live with it, and still restore our freedom. To go back to our lives. I mean, imagine for our kids. I'm talking just about adults, but what about our children? They've had to go through so much. See, my three are on holiday now. My three lovely kids are on holiday, and I'm so glad there's three of them. So they gel so well together, and they keep each other company. But and through the online classes and the pandemic, I mean, I can imagine for families how difficult it was, and how challenging, and even now for them to go back to school and start their social relationships, form their friends again, being in the classroom. It was really good to see, because they missed it. So all of us have gone through so much, children, everyone through different age groups, and even grandparents that were isolated and never saw their families. So now we're getting to live sort of a normal life as possible, but living with COVID. As you said, we need to still adhere to whatever restrictions or guidance and protect ourselves. So I think, it just feels for me psychologically and as a psychiatrist, this is the right moment to be thinking about it.
All right. Now let's move to the story of the day, of the week. Her Majesty herself, the Queen. But I love this woman. The reason I do is because, in spite of all that, I hear she's working on light duties at Windsor Castle this week, despite testing positive for COVID. Now, Buckingham Palace confirmed on Sunday that Her Majesty the Queen, who is 95 years old, was experiencing mild cold-like symptoms. Light duties likely includes reading state papers, which usually takes up a significant chunk of nearly every day. Now, the mood at Windsor Castle is one of caution and no major cause for alarm, so says the royal correspondent for BBC. And it's saying, they added that there is a sense it will be a business as usual as much as it is possible for the Queen. But the Queen's medical team will likely be keeping a very close eye on her, especially as she's considerably thinner and frailer than she was last year. So there's a bit of fear there. I mean, we know she's a very strong, resilient woman. We don't know that. And she's I can bet my last dollar that she's going to go through this. She's going to go through it safely and nicely. But at the same time, she's old. She's 95 years old. She's become a bit frail. She's become thinner than you. So it's a good thing that the medical team, they're keeping an eye on her. And we wish her all the best, to be honest. Now go on. Tell us.
Yeah, no, I love your optimism, and I 100% agree with that. The Queen getting COVID-19, obviously testing positive yesterday on the 20th of February. And this comes after she had attended her Jubilee on the 6th of February. She was in contact with other members of the royal family. Her son, Prince Charles, tested positive on the 10th, and Camilla also tested positive, I think on the 14th. So there are quite a few other members that have tested positive in the royal household. So the Queen, as you've said, she's tested positive. However, she's having mild flu-like symptoms. So there hasn't been any serious concerns in terms of her health. And in terms of her displaying any symptoms or signs of COVID-19 that are of concern that require her to be in hospital or further treatment. But Professor Hugh, who is the royal physician, is continuing to monitor her physical health and ensure that she gets the right treatment. So if she does need any further medication or treatment, she will be getting that. And as you know, the Queen is in great hands. I love what you said, we were also discussing it yesterday in the household, that the Queen, despite her age, I mean, she's 95, she'll be 96 on the 21st of April. It's the same day as Ferdinand's birthday, so we always remember it. And she's still working, still continuing with light duties, even though she's tested positive. And I mean, for me, I felt that was amazing. It was so remarkable. She's always been.
I'm not surprised. I'm not surprised. That's how she is. She keeps going. I just love her for that. Very strong woman, resilient. She does what she has to do. Sick or not, she does it. I'm very proud of her.
It's amazing. It's honestly amazing, because how many of us, if we tested positive, would we still go back to duties or do work? I don't think many people might be able to do it, but at her age, it's so admirable. I mean, you can only but love the Queen. She's always, since she's been Queen, she's been amazing, and she's really set such a high standard and example of monarch. She's done it so gracefully, and even now in times of her health, not being 100%, she's doing it, still able to continue to do it. So I think it says a lot about her. Yes, as you've said, everyone's been wishing her well throughout the world. She's been having it. There's been an outpour of comments. I was on Twitter yesterday as soon as the news broke out, and I sent it to you. So Boris Johnson has sent her well wishes. There's been mention of Gary Lineker, Prof. Keir Starmer, Sajid Javid. So, everyone has been wishing the Queen well and hoping that she recovers. So she's got a lot of support and people that are sending her positivity for her recovery. So to be honest, as you said, I'm not concerned. I don't think any of us are really concerned. God save the Queen. I saw that quote all over on social media yesterday. And, she's going to pull through this, and she's going to do well. I think the main thing is for me, the concern would be just containing whatever, at the Windsor and in terms of the other royals that have gotten infected, it's just about containing it and making sure that it does not spread further and that the Queen gets better. So yes, we're wishing her well from all of us, speedy recovery. And we hope that we can hear some good news that she's that she's recovered from COVID-19.
Don't worry, she'll recover. I know this woman. This woman is strong. She'll come out of it. She'll come out of it, definitely. Yeah. She just keeps going, man. She just keeps going. Fantastic.
I know. Wanted to mention, I think another important fact always when people do test positive, you want to know whether their COVID, what is their COVID vaccination stated. I did read in a newspaper article where they did say that she was triple vaccinated, but I'm not sure because I know.
I also read that well, according to the information we have, she is triple vaccinated.
Yeah. Which is fantastic. Which is fantastic news, because thanks for that confirmation, because I think that again helps. As I was saying a few weeks ago, I felt that vaccinations have helped us, have helped our patients, and and the community and globally save thousands and millions of people. So I'm really glad that she's had the vaccination, and again it shows the effectiveness and efficacy of the vaccines and why people should be vaccinated, because should you contract COVID-19, then obviously the symptoms might be milder, and there's a lesser chance of mortality and morbidity, and there's a lesser chance also of further spread of it as well. So the more people that get it, the better protection we all have. So I think vaccinations have played a huge role, and I'm sure the Queen, Prince Harry, we saw earlier on in the year talking about vaccinations and getting vaccines to the to other countries, to like in Africa. So I think they were all for vaccines. They were promoting it. So yeah, I'm sure the Queen is very grateful for the vaccines, and she was really in good form yesterday, because even they released a statement about the GB winning the team winning at the gold medal at the Olympics. So she was in
sent
top
them a
form.
congratulatory message.
Exactly. So I mean, that's amazing.
That's the Queen for you.
I know, that's a Queen.
No, that's fascinating. That's this thing I just read, and it's about when this COVID thing started, there were no drugs at all for it. There were no drugs, but I'm just reading that the first patients in the NHS are being offered a new drug to help treat COVID-19, and as COVID treatments are changing, fewer patients are becoming seriously ill or dying. So we know that fewer patients are here. So does this mean we are finally taming the virus? Have you heard about this new drug, and what is it? And I just read it.
Yeah. So, well, there has been sort of medication that has been used for COVID-19. So we know that we use steroids as well. That was the first sort of treatment, and antivirals. So I think in terms of the medication, there is other medications that have been used, so the antiviral medications, which they're obviously looking at. And I think obviously people are still getting to know about the different treatments of COVID-19. So in terms of medication, it is quite good news, isn't it? Yeah.
So I don't know what medication it is, because it didn't say on the article I read. Yeah. But I'm going to try and. But then, of course, you remember in America they were using what was it called again? This quinine medication, the malaria drug.
Yes. Yes, it was. It was an anti-malaria drug. I'm just trying
and in parts of West Africa, I know for a fact that in Ghana, Nigeria, and in the Ivory Coast, there's this drug. I'll try to remember. It's some sort of I think it was some sort of an antibiotic or something. I will look. I think I have a picture of the box somewhere. I'll find it. I'll tell you what it is. And when people contracted COVID and went to hospital, they gave it to them, and apparently it works. It's been working.
Yes, so the chloroquine, I think you're talking about chloroquine. That was the one that Trump was also advocating, that was quite good for COVID-19, Yeah. So chloroquine was a medication. We had antivirals. The ones I was going to talk about was remdesivir. So they're doing studies. Remdesivir, chloroquine, and also the steroids. So it could be a combination of these type of medications that they've been using to treat COVID-19. To be honest, there's still a lot of studies being done on the COVID-19, the medication. So I think there isn't one specific medication that people would say you would be using. So I think steroids was one, remdesivir, chloroquine, but obviously because of side effects of chloroquine and hydrochloroquine, I think that there was a bit of I think people were still concerned. So as always, it's a disclaimer that we are just giving information what's available, but we're not recommending any specific treatment. It's just a drug treatment that is available. So
we're not predicting any drugs here, no.
I think with all medications, there's effects and side effects. Ivermectin, that was the other one where they said that was one that was being used in South Africa and other countries. But from some studies, they're saying that ivermectin has been used in mild to moderate patients, but it does not, apparently the evidence suggests it does not stop the disease progression. I've heard of people going on ivermectin immediately when they tested positive, and it has been I mean, a lot of them had recovered. And I know in India as well, they were giving people ivermectin, South Africa, and other places. And I think UK was also looking at it. So all these medications, as I'm saying, it's not, I think steroids was probably the one when you went into hospital, and if you had to get treatment, they would have given you steroid treatment. The others are all still in research. So the remdesivir, hydrochloroquine, and the others.
Okay, let's look at what's the numbers then. And then
Yeah.
Yeah.
So I'm just getting the numbers just to refresh the page. Yes, so in terms of the numbers, COVID-19 as of today, the 21st of February 2022. So we have 425,357,786 positive cases globally. Total number of deaths, it's reaching 6 million, Apoku.
Mm-hmm.
So we're at 5,908,059 deaths, and every life matters. Total recovered is 351,129,675. So yeah, I don't know what's your thoughts on reaching 6 million. That's quite a large number.
That's large. That's really large.
Yeah. So in terms of the top five, we can do so USA number one with 80,087,617 positive cases, with 959,412 deaths. India number two with 42,838,524 positive cases, with 512,141 deaths. Brazil number three with 28,208,212 positive cases, with 644,362. France number four with 22,286,829 positive cases and 136,594 deaths. And UK number five with 18,605,752 positive cases, with 160,581 deaths. And South Africa is number 20 with 3,658,547 with positive cases, with 98,667. And we have, so we'll go to Ghana, which is at the end, right at the bottom, 110 with 158,220 positive cases, with 1,433 deaths. So that's the figures. I'm just going to go into the Worldometer UK 24-hour figures just to give an update of the past 24 hours. So we've had also, it's gone right down. So it's 25,696 new cases with 74 new deaths. And the day before was 34,323 positive cases with 128 new deaths. So yeah, and we know the Queen is the latest addition to test positive. Yeah. So the numbers are going down. As I was just reading those figures, I just felt so much calmer and happy and more positive. It's like we've been waiting for this day. And today feels like one of those days, since we've been broadcasting. I think, was it the 2nd of February, 2020 on COVID-19. So it's been just, it's been like 2 years now. So it's
2 years now. It's just gone past 2 years.
I know. That's only on COVID-19.
Well done. Congratulations.
I know. Well done to you as well. And
well done.
know. And I just feel, I felt, so I don't know how you felt, but I just feel like today and this, the point that we're all coming to with and what Boris Johnson's going to announce today is going to be important for a lot of people, just to
talking about this, I've been doing this for 2 years now, constant update, on COVID, on Hospital Radio Veteran. I think this particular segment of the show should be sent in to the HBA, or Hospital Broadcast Association, for a possible award.
Fantastic. We should do that. Let's do that.
Yeah, I think we should send it. It's not for me. It's for the station. It's not,
Fantastic.
It's for Hospital Radio Bedford. I think this is definitely an award winner. I don't think any station does or has ever done that, or they do like a COVID update every morning for 2 years.
I know.
I don't think so. I haven't heard.
No,
Anyway,
thank you so much. I am
blowing
so
our own horn, yeah, but sometimes you've got to blow your own horn.
I am so grateful to you. And if I can just say, I was updating my podcast book. I don't have it in front of me, others that have showed it, but I actually wrote, and I was going to send it to you later today, but I've written a dedication to you.
Well, thank you.
To and your wife Sika, to Opoku Pare and Sika, and I'm just thanking you for the support and for giving me this opportunity, because talking not just about mental health and about the psychological effects of COVID-19, and just being able to broadcast for these 2 years and more, because we started well before then. And so I will share my dedication, and I was just glad I'll be able to. It just happened that I needed to say it now. So definitely you've been so supportive, and you've helped, and like you said, us talking about it, educating ourselves, and knowing more and helping other people, because we've had good feedback from all over the world. People have been contacting.
Yeah, absolutely, yeah.
And daily people will message us asking us about advice about the vaccines or medication or the travel. And obviously every disclaimer that everything is obviously, we say, look at the WHO guidance and government guidance, and we're happy to help. But you've been instrumental, so I'm so grateful for this opportunity. I also dedicated it to Valma James as well, because she was the one that was really important. So thank you so much.
We couldn't have done it without Valma. I just want to say a huge thank you to you from not just myself, but from the whole of us here at Hospital Radio Bedford. There's no way we'd have done this without you. So thank you for your dedication, for your commitment, and for everything.
Thank you.
Unfortunately, we've only got 11 minutes to go.
I know. So, thank you so much. Yeah. And thank you to Hospital Radio Bedford. Jeff White as well, not forgetting him, and Valma.
Oh, yeah, absolutely. Yeah, my brother from another mother, that one.
I know. And all the other presenters are absolutely amazing. Thank you for the opportunity. And, it's been a roller coaster, but we've all got through it. And it's just great to be at this moment where we get to see things becoming so much more positive, and everyone's living with the hope and recovery and well-being, and everyone's happier. And we're going to be able to, as Boris Johnson is saying, living with COVID and restoring freedom. So I think that's what we need.
Thank you very much. Right, so that was Dr. Session Mulia, consultant.
Bye. Have a wonderful day. Thank you so much. Thank you, Opoku, and thank you to everyone listening. Hope you have a wonderful day, and namaste. Thanks, everyone.